Hi everybody, I'm Dr. Brown, the Chronic Fatigue Syndrome doc, CFS doc. I'm recording this as I'm getting ready to go do my photo shoot for my website. I got a friend who's kind of an amateur photographer. He doesn't really identify as a photographer, but I think he is. He's gonna take my pictures. But I thought it would be efficient to record while I did my makeup, and I've seen other people do it, and I kind of like how casual and conversational it seems. Of course, it's going to be kind of awkward as I close my mouth to put my makeup on, so I don't really know how I feel about this particular format, but I'll give it a shot. So today, I just wanted to talk a little bit about brain training. Part of my recovery story, and for those who are new, I'm a CFS patient, now a doctor treating CFS. Part of my recovery story involves the ANS Rewire program, which is a brain training program. I haven't tried any of the others. Gupta does one that I know. I've seen some others. They usually run $300. I've seen one that charges almost $300 a month. And the main purpose of these brain training programs is to do something that I call rehabilitating the nervous system. Now, these programs are somewhat controversial because they can give off the impression that we're implying that this is a psychosomatic disease, or it's all in your head, or that it's psychological in some aspect. And it's a fair critique. It can be extremely triggering for those of us with medical trauma who have been brushed off or called crazy or implied that we were crazy by the physicians, the people who are supposed to help us. So I think it's normal that we as a community of people with an invisible illness be sensitive to anything that implies that our condition is anything less than a disabling physical condition that has not received enough interest or funding from society at large. But if you discount all brain training programs, you are throwing out a useful and effective tool from your toolbox to help you recover. And I say that because I personally would not have recovered, and certainly would not have recovered as fast without the ANS Rewire program. And there's many stories of people, online who recover with the use of these programs. Now, does this mean that CFS is psychological? No, it doesn't. Does it mean that our psychology affects our disease? Yes. And that's true of almost any physical illness. Cancer is affected by psychology. Pain, diabetes. So let's talk about diabetes for a minute, okay? I'm a family doctor. Diabetes is my bread and butter. I've seen people with diabetes whose sugars go from constantly high, really high, in the 200s, the 300s, down to right around normal with a pill and a change in mindset. And this isn't even necessarily a change in behavior, right? Metformin, the pill I prescribe, is not going to reduce your blood sugar levels an enormous amount. It just doesn't. But when you stop flooding your body with cortisol, your blood sugars go down. And that's because cortisol, the stress hormone, the effect that it has on your biology is to cause your liver to release glucose into the bloodstream so that your body has the energy for fight or flight. That's just what it does. And so acting like how we think about things and how stressed out we are doesn't affect our biology. We have this false dichotomy in our society and in how we think about things, that the physical and the mental, emotional are like two separate things. They're not. Every single thought that goes through your head is physical. There's physical neural connections happening that are what that emotional state or what that thought is. At least from the outside, right? Likewise, when we reduce people's heart rates, when we affect their biology, we affect their emotional states. They're not as anxious because the emotions are felt within the body, and the biological processes, the physiologic processes of the body are felt in our conscious experience. So it's really silly to draw this hard line between the two and say, if you think that psychology is going to affect how my body acts, then you're just implying it's all in my head. What does all in your head mean? There's nothing that's in your head that is not also in your body. Your brain is in there. It's a part of your body. So if you're looking for a doctor to treat your chronic fatigue syndrome, I encourage you to check out my website. Come see me. I'm taking new patients right now. But whether you see me or not, consider starting the ANS Rewire program or one of these other brain training programs and see how it affects you. Many people will recover just from using the techniques in these programs. Many people won't, and those are probably the people that need to see me to figure out what underlying issues are preventing their bodies from being able to heal, right? So I'd love to hear your all thoughts on this. Please comment below, like, subscribe, and I'll see you in the next one. Bye.